National Preparedness Month webinar. Be informed and stay informed during and after an emergency. National Preparedness Month. September is National Preparedness Month, and we should encourage first responders and their families to make a commitment to prepare for emergencies by following 3 simple steps. 1. Be informed before, during, and after an emergency. 2. Make a family emergency plan. 3. Get an emergency supply kit. Be informed. Today, we will go over the importance of being and staying informed during and after an emergency. In order to keep families safe in an emergency, it is important to plan in advance. Here are some guidelines and tips to follow. 1. Plan for a pandemic. 2. How to stay alert and stay safe on public transportation. 3. Talk to children about crisis events. 4. Know when and how to shelter in place. 5. Why emergency alerts are important to your safety. Plan for a pandemic. You can prepare for an influenza pandemic now. You should know both the magnitude of what can happen during a pandemic outbreak and what actions you can take to help lessen the impact of an influenza pandemic on you and your family. This checklist will help you gather the information and resources you may need in case of a flu pandemic. Before a pandemic, store a 2-week supply of water and food. During a pandemic, if you cannot get to a store or if stores are out of supplies, it will be important for you to have extra supplies on hand. This can be useful in other types of emergencies, such as power outages and disasters. Periodically check your regular prescription drugs to ensure a continuous supply in your home. Have any non-prescription drugs and other health supplies on hand, including pain relievers, stomach remedies, cough and cold medicines, fluids with electrolytes, and vitamins. Talk with family members and loved ones about how they would be cared for if they got sick or what will be needed to care for them in your home. Volunteer with local groups to prepare and assist with emergency response. Get involved in your community as it works to prepare for an influenza pandemic. During a pandemic, limit the spread of germs and prevent infection. Avoid close contact with people who are sick. When you are sick, keep your distance from others to protect them from getting sick too. If possible, stay home from work, school, and errands when you are sick. You will help prevent others from catching your illness. Cover your mouth and nose with a tissue when coughing or sneezing. It may prevent those around you from getting sick. Plan for a pandemic. Washing your hands often will help protect you from germs. Avoid touching your eyes, nose, or mouth. Germs are often spread when a person touches something that is contaminated with germs and then touches his or her eyes, nose, or mouth. Practice other good health habits. Get plenty of sleep, be physically active, manage your stress, drink plenty of fluids, and eat nutritious food. How to stay alert and stay safe on public transportation. Follow the guidelines below to help make public transportation a secure environment for everyone. People without vehicles should know local plans for public transportation and may need to make arrangements for transportation from local government, organization, or others. Individuals who require accessible transportation should work with their local paratransit and disability service providers to make an emergency plan. Remember to take all of your belongings with you when you leave a train or bus. Be alert and observant while traveling. Report any suspicious behavior or activities that seem unusual or out of place, such as acting nervous or sweating inappropriately, taking pictures or videotaping in areas of no interest to the general public, attempting to get into an area that is off limits, leaving a package, backpack, or briefcase and hurrying away from the area. Report any broken equipment, missing lights, or strange odors. Without touching them, report any abandoned items to an employee. Here are some questions to ask when observing a suspicious package. Is it out of the way or hidden? Was it abandoned by someone who left quickly? Does it have lumps, bulges, or protrusions like wires, tanks, or bottles? Is it surrounded by clouds, mists, gases, vapors, or odors? Does it have a threatening message attached to the outside? Talk to children about crisis events. Don't forget to talk to children about crisis events. Disasters can leave children feeling frightened, confused, and insecure. Whether a child has personally experienced trauma, has merely seen the event on television, or has heard it discussed by adults, it is important for parents and teachers to be informed and ready to help if reactions to stress begin to occur. Some children may respond to disaster by demonstrating fears, sadness, or behavioral problems. Younger children may return to earlier behavior patterns such as bedwetting, sleep problems, separation anxiety. Older children may also display anger, aggression, school problems, or withdrawal. Some children who have only indirect contact with the disaster but witness it on television may develop distress. When parents and caregivers or other family members deal with crisis calmly and confidently, children feel more confident and secure. A child's reactions are influenced by the behavior they see. The better prepared you are, the more reassuring you may be during an emergency. This can help children cope. Before a crisis event. How can parents and caregivers prepare before a crisis event? Get informed. Know what hazards are in your area. Know evacuation routes and disaster plans where you and your family spend time. Develop a family disaster plan. Being prepared can help the whole family cope better and have a greater sense of control. Assemble a disaster supply kit. This kit can help your family stay safe and be more comfortable during and after a crisis event. During and after a crisis event. During a crisis event, show understanding. After a crisis, children are most afraid that the event will happen again. Someone close to them will be killed or hurt, or that they will be left alone or separated from their family. You can help them by sharing facts with them about the event and plans to keep them safe, encouraging them to talk or express what they are feeling, listening to their concerns, giving them specific tasks to do. This lets them know they can help and can restore a sense of control. Spending extra time with them, reestablishing daily routines, understanding that children have different reactions to crisis events based on their maturity, age, and experience, knowing when and how to get help for a child who continues to suffer. Monitor and limit your family's exposure to the media. The news can bring out fear and confusion among children and adults. Watching images over and over can cause younger children to believe the event is happening again and again. Parents and caregivers might want to talk about what is being shown on TV with them. Use support networks. Parents and caregivers are almost always the best source of support for their children in difficult times. It is important for adults to understand their own feelings to manage their reactions better. Adults in control of their feelings are better able to support their children. How to shelter in place. Know when and how to shelter in place. In an emergency, local officials may tell you to seek safe shelter or shelter in place, which means to stay inside or go in the nearest building when a disaster strikes. It is a way for you to stay as safe as possible until the emergency is over. Let's go over a case of an emergency fact sheet. 1. Shelter. Go inside your home or the nearest building. Choose an inside room with as few windows or doors as possible. Bring in pets if possible. 2. Shut. Shut and lock all windows and doors to create a better seal. Turn off the heater or air conditioner. Make sure the fireplace damper and all ventilation fans are closed. If you are told there is danger of explosion, close the window shades, blinds, or curtains. 3. Listen. Local officials are your best source of information. Keep listening to your radio or television until you are told it is safe to leave the shelter or to evacuate. When you leave the shelter, follow instructions from local officials to avoid any harmful materials outside. Do not use a telephone unless you have a life-threatening condition to keep lines free for emergency responders. Additional shelter-in-place information. 4. Things to keep in mind during shelter-in-place. Most likely, you will only need to shelter in place for a few hours. Choose a room with a hardwired telephone in addition to any cellular phones you may have. Cellular telephone equipment may be overwhelmed or damaged during an emergency. Gather your emergency supply kit or essential disaster supplies ahead of time, including canned food, a hand-operated can opener, bottled water, battery-powered radios, a first aid kit, flashlights, batteries, duct tape, plastic sheeting, and plastic garbage bags. Remember not to drink water from the tap, as it may make you sick. Make sure all necessary medicine is convenient. Ask your doctor about storing prescription drugs, such as heart and high blood pressure medication, insulin, and others. If your children are at school, they will be sheltered there. Unless you are good to do so, do not try to get to the school to bring your children home. Taking them from the school will put them and you at increased risk. You should not shelter in a vehicle, as this does not provide enough protection against harmful materials. 5. Things to keep in mind for those with special needs. Make sure you have all the supplies that a baby or child will need. Remember to include formula, diapers, bottles, medications, and diaper rash ointment. Seniors and people with disabilities should include extra eyeglasses, hearing aid and/or wheelchair batteries, oxygen tanks, and/or special equipment in their disaster kits. Also include a list of style and serial numbers of medical devices such as pacemakers. Make sure that others know how to operate equipment such as wheelchairs. People with disabilities should create a support network to help them in an emergency. Make sure someone knows where your disaster supplies are and can get into your house or apartment in an emergency. 6. Tips in the workplace. In addition to the instructions we have discussed, use the following guidelines in the workplace. Close the business. Ask customers, clients, or visitors to stay in the building. If the business has a voicemail system, change the recording to say that the business is closed and that staff and visitors are remaining in the building until officials advise it is safe to leave. Write down the names of everyone in the room and call your business's emergency contact to report who is in the room with you and the relationship with your business, such as employee, client, customer, and visitor. 7. Chemical, radiological, and biological emergencies. These are 3 types of emergencies where you may be told to shelter in place. Keep the following tips in mind for each type of emergency. Tips for chemical, radiological, and biological emergencies. Chemical. A chemical emergency can happen anywhere harmful materials are manufactured, stored, or shipped, including chemical plants, highways, railways, and storage containers at local swimming pools. Examples of chemical emergencies could include chlorine, mustard gas, resin, sarin gas, or arsenic. In the case of a chemical emergency, an above-ground shelter-in-place is better because some chemicals are heavier than air and may seep into basements even if the windows are closed. If your eyes are watering, your skin is stinging, and you are having trouble breathing, you may have been exposed to a chemical. If possible, take a shower with warm water and soap, change your clothes, and put what you are wearing into a plastic bag. Any clothing that needs to be pulled over the head should be cut off instead. After a chemical emergency, open all doors and windows, turn on your heater or air conditioner to ventilate the house, and go outside. Radiological. In a radiological emergency, you may be told to shelter in place or leave the area. Examples of radiological emergency could include bombs that contain radioactive materials called a dirty bomb, an explosion at a nuclear plant or of a small nuclear device. In the case of a radiological emergency, the safest place is a centrally located room or basement. If you think you have been exposed to radiation, take a shower with warm water and soap. Change your clothes and put what you are wearing in a plastic bag. Pets should also be brought inside and washed with warm water and soap. Only take potassium iodide, Ki, if local officials tell you to do so. KI only protects the thyroid gland and does not protect from any other radiation exposure. It should only be taken in an emergency that involves the release of radioactive iodine, such as in an accident at a nuclear power plant or the explosion of a nuclear bomb. A dirty bomb most likely will not contain radioactive iodine. Biological. A biological emergency involves the release of germs or other substances that can make you sick. Examples of biological emergency could include smallpox, salmonella, or anthrax. Many biological agents must be breathed in or eaten, while others can enter through a cut on the skin. Some, like smallpox, can be spread from person to person, while others, such as anthrax, cannot. If you think you have been exposed to smallpox, stay away from others and call your county health department, your local doctor, or health clinic immediately. If you see a package or envelope that you believe may contain anthrax, do not open it. Leave the area, close any doors, and take actions to prevent others from entering the area. Immediately wash your hands with soap and water. Call 911 or local law enforcement for additional instructions. Emergency alerts. Now let's review emergency alerts. You can receive important life-saving alerts no matter where you are, at home, at school, or at work. Public safety officials use reliable systems to alert you and your family in the event of natural or man-made disasters. Many communities also offer emergency alert notifications through their own systems. Wireless emergency alerts, WEAs. Alerts received at the right time can help you be safe during an emergency. A WEA warning can be sent to your mobile device when you may be in harm's way, without needing to download an app or subscribing to a service. What types of alerts would you receive? Extreme weather, other threatening emergencies in your area, Amber alerts, presidential alerts during a national emergency. What does a WEA message look like? A wireless emergency alert looks just like a text message. NOAA Weather Radio All Hazards NWR is a nationwide network of radio stations broadcasting continuous weather information from the nearest National Weather Service office. NWR broadcasts official warnings, watches, forecasts, and other hazard information 24 hours a day, 7 days a week. It also broadcasts alerts of non-weather emergencies such as national security, natural, environmental, and public safety through the emergency alert system. Be informed and stay informed during and after an emergency. In closing, here is a summary of what we reviewed. Prepare for an influenza pandemic and limit the spread of germs and prevent infection. Stay alert and safe on public transportation. Report suspicious behavior or activities that seem unusual or out of place, and know the questions to ask when observing a suspicious package. Talk to children about crisis events. Understand children respond to disaster differently, and the reactions are influenced by the behavior they see. Before a crisis, develop a family disaster plan and assemble a disaster supply kit. Know when and how to shelter in place, and remember those with special needs. You can receive important life-saving alerts no matter where you are. Remember, emergency preparedness starts with you. Plan, prepare, train. Be ready when the time comes. Please check out all of the webinars the Illinois Department of Public Health Office of Preparedness and Response is offering to support awareness of National Preparedness Month in September. They include Prepare an Emergency Supply Kit, Disaster and Emergency Planning, Prepare for a Flood and Tornado, and the one you just listened to, Be Informed and Stay Informed During and After an Emergency. This concludes your presentation.